So there are different inserts that are available. Some are typically given by a provider. So when women come to the office, we offer a pessary trial. And a pessary is a little silicone ring, kind of looks like a diaphragm. And we just fit you for a pessary that should be comfortable. You really shouldn't feel it while it's inside. But for conditions like leakage of urine with coughing or sneezing, they can provide support to prevent that leakage. Or for women who have a vaginal prolapse where tissue is coming out of the vagina and we're like, what is that? It can lift that tissue back in, so lifting that vaginal wall back inside. So that's usually fit by a provider, and then the patient either leaves the office with a pessary or they're able to pick that up from a medical supply. There are over-the-counter options as well. So Poise even makes a little product called Impressa, which is inserted like a tampon into the vagina. And it has this funny shape to it. So it has the same job as the pessary, where it supports the urethra to prevent the leaks when you cough or sneeze. And you just pull it out with the string, just like a tampon at the end of the day.
Who knew?
Yeah.
You can do that. You can do that before you go dancing.
You can try that out.
I have patients that they'll put it in before they go dancing, before they go to the gym, and it's like that provides them enough support to get through those activities. They don't need it all the time, so.
Never even heard of it.
Yeah.
Okay.
Yep. These are things that even women who've never been pregnant come in with a lot of these conditions. And while we know that pregnancy and childbirth is a risk factor for developing bladder incontinence, it's not the only thing that can lead to it. So nobody's safe.
Great. Good to hear.
Are there any kind of like maintenance exercises you can do just to try and prevent that in the future without like seeing your doctor or anything like that?
So we do know that, core exercises, strength training to a degree is helpful. So just building that core helps us to naturally support our pelvic floor muscles. So the levator muscles that help to maintain continence and lift the pelvic organs in the body. We also know that really excessive exercise or really strenuous exercise like CrossFit can have the opposite effect. So those things that are maybe pushing the limits for women, where we're lifting extremely heavy things, can actually result in pelvic floor disorders like bladder incontinence. So you have to be careful, as women. For us, we do have to be cautious about that because we know that that can lead to other pelvic floor disorders. But being active, doing yoga has been shown to help. So the activities that strengthen the core all kind of in an indirect way kind of help with the pelvic floor muscle support.